Hey everyone, welcome to the Hey Hannah podcast. I'm your host, Dr. Maya Fields, but to my friends and those who know me well, I'm just Maya. I'm a higher education administrator, a mother, and a wife of 14 amazing years. But above all, I'm a Christ follower. This podcast is a special platform created to honor the memory of my beloved daughter, Hannah. It's here that I have the chance to have the conversations that I never got to have with her, to share the wisdom and love I wish I could have passed on. It's a reminder to cherish the precious moments we're given and a testament to the power of healing, hope, and personal growth. If you're someone who's seeking personal growth, inspiration, and practical advice to build a solid foundation for a successful and fulfilling life, this is a place for you. Join me as we honor Hannah's memory together. Laugh, cry, and learn. Get ready for a podcast that is so much more than you could ever imagine. The Hey Hannah podcast, healing hearts, one conversation at a time. Hey everyone, welcome back to another episode of the Hey Hannah podcast. So glad that you are joining us today and tuning in. I hope that you're going to learn some fun information just to help us better parent these children. I feel like I definitely need help with that all the time. Always learning, always growing. And we have Michelle McVittie here today. She is a child life specialist and she is going to chat with us about everything in her world. So thank you, Michelle. So excited to have you here. Just thank you for being here so you can have this conversation with us.
For having me. I love having these conversations because I don't think we have enough of them, especially around parenting. So I'm really excited to be here.
You know, you're absolutely right. I completely agree with you about I feel the same way about not necessarily having enough conversations around parenting. And it kind of blows my mind. Like when I had my first son and you're leaving and there's like no type of mandated education. It's just kind of like you get to take a human and do what you will. And so it's like you may decide to take some parenting courses, you may read a few books, but if you don't have to. I mean, you don't really have to do anything. And so, you always want to be growing and evolving as a parent. And so I definitely feel like people like you who are working in this space and who are committed to helping us better ourselves, first of all, we appreciate you. But man, that has to be a lot of work because you don't really know like where someone's coming in at, with their education level and parenting.
Yeah, it's so funny that you say that because yesterday, I do everything virtually. So when I signed on with my clients yesterday, they ask you, how are you doing? And I'm like, I'm great because my clients are amazing and it doesn't feel
Yeah.
like work. So,
Yeah.
um, and that's the piece where working in the system, I worked in pediatric medical and mental health for over 20 years. I see the gaps, I see the crisis support. And that's where I started my business because there are many people like you and I that just need to know, where is my information coming from? This
Yeah.
child is okay. This one, I do the exact same things. Something is up. Then I go to
Yeah.
my doctor, they'll grow out of it. Oh, not a big deal. And you're like, so does my face need to be in the carpet before I get some help? And then when I get help, there's a huge wait list. I'm not okay
Yeah.
with that. Right?
Yeah.
Yeah.
Absolutely. It's like everywhere you turn, at some point you're kind of hitting a wall. Um, but I do feel like obviously I'm in education and as a professor, I have a baseline. Like I know if you're in my grad level class, you have a high school diploma, you completed high school, we have that kind of down, and you have an undergrad degree. So if you
Yeah.
tell me like I don't know my ABCs, I know that's not true. You know,
Yeah.
we we have a starting point. And
Yeah.
so that is one of the things I'm very thankful for about the education system. But for you, not really knowing the level of, or the parenting kind of scope that a parent is using coming into your care or just coming to work with you, how do you even get to a starting point so you can shape a program or some type of offering that's going to be beneficial for whoever walks through your door or
Mhm.
logs into your Zoom since we're in 2023.
Yes, yes. I guess that's my superpower is that
For sure.
I can connect and assess fairly quickly what is going on and how a parent
Nice.
presents. So it's very different, my business, because when you have someone coming to me, they're in a different state of mind than in my clinical world, we're working for a children's hospital. Some of those parents are voluntold, or we've been waiting for so long. We're in crisis. We feel like the system has failed us.
Yeah.
There could be children's aid involved in things like it's a lot of different things. So when I see my clients, and I work for a private practice under a psychologist as well. Um, you get a little bit of an idea, but you have parents that are committed and you have
Mhm.
parents that are coming to you saying, I'm feeling stuck and I'm ready. Because if they're not committed, if they're not ready, if all the scaffolding has not been developed, we just have to start at a very slow baseline. And a lot of that is just validating them and their struggle, understanding their background and what they kind of grew up with. And what are those daily struggles? And how do we take one step forward? So sometimes you're seeing people, I mean, my one client, it's not good for my business. They saw me once. They were very educated parents. They were
Yeah.
kind of, you meet with them once and they're like, but what about this? What about this? And I'm like, here are some concrete examples. Here are some strategies. I message them. I'm like, okay, I have this appointment. And they're like, it's kind of a waste for us to see you because we've seen such a huge change.
Uh,
But I would rather that. But I'm
yeah.
there for a parent no matter what the level, and my 20 years of experience of seeing so many different levels, it really helps me with those assessments.
Understandable. And I can definitely see how helpful it is that you're able to kind of weed through and figure out where everyone is pretty quickly because then you can start getting the help you need. A lot of times we don't necessarily want to feel like, oh, someone's putting together a story about us very quickly. But I
Mhm.
mean, if we're being honest, it helps kind of save some time on,
It does.
getting getting to the
Yeah.
resources that you need and the reason, while you're seeking help in the first place in many cases. I know you specialize in working with strong willed children, children who have ADHD, and maybe just parents feel like I am at a loss. So I'll say my youngest, who is now 5, he just turned 5 in November. So that's why I paused. I know my children's ages, people, but man, I think part of it was him being 4 or 5, the age. But
Mhm.
he was like went through this very persistent stage of just like he wanted to dig his heels in and do what he wanted to do. And he's very emotional child. So it's just kind of like the outburst. And I felt like I was at a parenting loss. I
Yep.
just really didn't know what what to necessarily do because I feel like you can't do nothing.
I
I
know.
mean,
I
and
know. It's
but it's
true.
like, well, what do you do? Like you just can't let the child run the house. So how do you, my question in a very long way,
Mhm. Yeah.
how do you recommend, especially when parenting strong-willed children, parent in a way that doesn't cause long-term damage? Because you don't want to yell, you don't want to say the wrong thing, but you do want to make sure that you're setting up some form of structure, like it's just not the wild, wild west. So,
Yes.
what do you recommend?
Yeah, well, I think that one is you have to know your triggers because even what you were saying is that societal norms of you might be at your mom's house and you can't let your child talk to you that way. I can't believe they had a temper tantrum and you didn't punish them. Like, that's embarrassing. Don't act that way. No one wants to be that parent that has a child screaming in the candy aisle. So here's the candy. Here you go. Let's just get going. But if you have these thoughts, and then you have this shame, and then your distress tolerance is low, we tend to jump in, we tend to fix and just kind of give. Some parents go the
Yeah.
other extreme where they punish, and punishment doesn't teach anything.
Mm.
Right? Like, if I grounded you because you didn't wash the dishes or come home on time, does that change anything? No, and depending on your personality, you might be more sassy and be able to get out of the window and out the door, back in, right? Like, it really depends on the child's personality, right? So, when we look at a child that's a little sassy or a little more strong-willed, what comes up in you? And how do you respond? And are you responding versus reacting?
Yeah.
And your child is a super feeler. They are picking up on your agitation even when you're smiling. I'm a super feeler. My son's a super feeler. I can't even walk in through the door and something's been up and he's like, "What's the matter, mom?" And I'm like,
Oh,
"How did you know that?" Right?
I love that.
So they're melting down sometimes because you give the purple cup and they wanted the blue cup. It's not normally about the cup, and we're fixated on the cup, and we're fixated on stopping the
Mhm.
behavior, and we have to step back and look at all those different layers, which is complicated, right?
Absolutely.
Yeah.
Absolutely complicated.
Mhm.
I know you mentioned, and you're right, it had me thinking as you were saying about the punishment, it doesn't really change anything in a lot of
No.
cases. But what type of tool, I know I've heard like the reward charts aren't necessarily like the best thing if you're because then you teach your child like to kind of shoo away from the intrinsic motivation and always, do things because you get something. And so we don't necessarily have that as a top choice. The punishment is not there. Not that I'm an advocate for punishment, but I'm just wondering, well, what tools do parents have when we do see behavior that's exhibited that we don't necessarily want to encourage?
Mhm. Yeah, that's a great question. And I also love to hear what you're saying about what is out there in the world. And
Mhm.
this is why it's so frustrating, I think, for a lot of parents, because you can find a blog that will say, remove red food dye and all your problems will go away. You
Yes.
can find an expert that will say, don't use reward charts. They are, yes, and really, if you think about a child, is it that they won't or they can't? And a lot of times we think they won't. So when we give them a reward, then, well, they have to be motivated. They
Mhm.
have to want to do that. Listen, I'm motivated by getting paid, okay? Like, I am motivated by, like, there's certain things that I'm motivated for that this if I wasn't there, if I wasn't getting paid, I'm sorry. Like, I like you, you're a nice parent, but I'm not doing this for free, right?
Yeah.
So like, we're all kind of have those values, and of
Yeah.
course we want our child to want something, but when it comes to potty training, people are okay giving that Smartie. Are you giving a Smartie until they're 15? I hope not, right? The purpose is to get a behavior started. I
For sure.
literally am talking about reward charts with teenagers, with parents, because they struggle. Now, we're talking about children that have, you know, multiple mental illnesses. There is
Yeah.
stuff getting in their way. And just to say, go to school and I'm going to give you a Smartie is not going to work, right? But instead, it's like, I'm noticing your effort. What are the barriers to getting there?
Yeah.
How can we get you there? And it's the same thing with our children. Like, we're talking like a 5-year-old that's very emotional. If we're talking about your child, brain is under construction until 25, 30 for neurodiverse children,
Oh,
right? I know. My brain just developed last year. It just finished. I'm just kidding. I wish.
that's a good one.
Um, But yeah, like, we have to give children some space for emotion. And that is actually what one of my clients just said yesterday. And she's like, I'm not reacting. She had a meltdown, and I just let her have her meltdown. It wasn't over anything in particular, and I just let her be emotional. Um,
Yeah.
and and it eventually went away. But you have to be able to tolerate that. And a lot of us can't tolerate somebody else's distress. Or when we start crying, what do we say? I'm sorry. Why do we
Yeah.
say that? Because I am burdening you with my emotion.
Yeah.
And a lot of people are uncomfortable with emotion. So we want to throw butterflies and fairies at this. Or it's triggering for me when I hear adults telling other adults, don't cry. Why?
Mm.
Why can't I cry? I'm emotional. And this is my experience. And your 5-year-old freaking out over the purple cup. Okay. I'm really sorry I didn't know you wanted the blue cup. It doesn't mean I'm going to give you the blue cup because your brother's already drinking out of it. But yeah, like I had no idea you wanted that cup. And really, is it about that? So the rewards, they do work because they're motivators. But it's not about walking around with $5 bills and saying, oh, you did this. It's really about being clear, just like potty training. We want to focus on what they are doing. We want to focus on what we want to get them started doing and also controlling our reaction. So instead of jumping in with punishment, but instead of, being like, you can't do that, enough is enough, and us getting heated and them getting heated, we can set a firm boundary and say, I see that you're angry, but you're screaming at me and I cannot help you when I'm screaming at you.
Yeah.
You really wanted that candy in the candy aisle. We discussed we can have one. Now you're screaming for two, only one. So now they're both going back. And yeah, there's going to be a meltdown and you're going to have to tolerate it. You're going to have to tolerate the fact that people are walking by, looking at what's going on. And maybe they're not judging you. They're probably walking by and going, oh my goodness, I'm glad it's not me today. Like, keep going, mama, right? Like, but we get all riled up, right? We get all riled up and it's like, you know what? What are we going to do? And maybe it's because I'm older. I've kind of relaxed a little bit with what other people think because it's really none of my business what other people think of me.
That you said so many good points. I'm just soaking it all up. I really am. I'm just soaking it all up. Um, you know, one of the things for me is I had to come to the realization that maybe I had unrealistic expectations for what I guess just appropriate behavior. And so I think that's what really kind of helped me more to put things in the place of like, he's having a meltdown, but he's 3. That type of thing
Yeah. Yeah.
versus like, you need to be quiet. You don't need to like you shouldn't yell or it shouldn't be this big of a deal. And I feel like that's helped me a lot with as far as just like reacting. And so I think it's helpful for any parents who are listening and like, well, how can I go from just reacting to this is kind of what it is at the moment. I think part of it is just assessing like, are your expectations even realistic? Like, realistically, should you expect a 5 or 6 year old to sit quiet through, a seminar or whatever for an hour? Most adults can't do that. So let's, remember what it may have been like to be a child or just, that type of thing. And sometimes I think we as parents have to really just check our expectations because some of the things, if we listen back to it, that we're expecting of our children can be a bit ridiculous. If we're
I
being
agree with
honest.
you. Yes. And I had a parent ask me that. It was a parent that had a child with ADHD. And she's like, so I'm just supposed to lower my expectations? And I'm like, no, I want you to alter them because your child with ADHD, their brain is under construction until 30, and their executive functioning skills, such as emotional control, task initiation, organization, impulsivity, can be up to 3 years behind. So you're looking at this child that is functioning more like a 5-year-old, but they're 8 and then they're
Yeah.
trying to fit in. And then you have another child where they are like making their own lunch. They're basically getting to school on their own. And you think this child can barely, brush their teeth and get out of the house. What is going on? Like, and
Yeah.
then you get frustrated because then you start comparing the children. And then a
Mhm.
lot of parents start feeling defeated, right? That it's like, look, we dealt with anxiety with our first one. Okay, here these we know the strategies. It's not working with our second. Our second is like her anxiety is just so strong and just taking over and she's like, and it's like, so what do we do? And then you go to the doctor and the doctor's like, "Oh, don't worry about it. It's fine." And it's like, "But this is not fine." Like, so where do
Exactly.
I go? Yeah, what do I do? It's not, and the thing is I'm never going to give you a black and white answer. And I think I love your pointed questions because I don't know if I'm frustrating you because I haven't really given you a clear answer because there sometimes is not a clear answer. And yes, I
Yeah.
can give you like use the when then. When you do something I want you to do, then you get something you want. First and then works. First underwear, then pants. First sunscreen, then outside. Sure, that works. And then you have a child that's arguing with you. And then parents will say, oh, they'll flip the when then around on me. And I'm like, well, then we need to talk. So there's like basic things that parents are like, not with this kid, like, or it worked for 2 days and now we're back to it because routines, structure, parents' reactions are important. Consistency, setting boundaries, checklists, timers, visuals, expectations. Those are the things that work. But where would you get started?
Absolutely.
Right? Yeah.
Well, you mentioned about the not having the black and white answers. And, honestly, I'd be a little alarmed if you did, because this is the thing that I picked up somewhere along the way. Even though, and I think this is a common thing you'll hear with parents like, well, this kid did it this way, and then this kid is totally different. Sometimes I
Mhm.
think we have the assumption that because they are our children that are in our
Yes.
home, that it's just kind of like a group deal. The kids are right
Yes.
here in the top, parent, 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 this particular way,
Yes.
and it's all going to work. But we do have to realize that these are individuals. So a lot of us are in organizations with different coworkers. We work for the same company. You may have the same job title, but you have to interact, handle, grow that relationship completely different. So we have to remember that too with our children. It's not a one size fits all, like they're people. But you hit on the right things that we do have, we're implementing a strong value system. Like,
Right.
okay, you're completely different, but it's not okay for you to just, you know, lie all day because that's the way you feel. So we are still
Yeah.
going to have some values, but things are just going to, the way we handle and the way you motivate each child is gonna be a little bit different. I think that's too a part of, like, the expectations that you have as a parent. And as you can probably tell by now, I had a hard slap in the face about my expectations. So I'm always telling myself, like, "Do you have clear, healthy expectations right now about this?" And sometimes, I mean, just being honest, I don't. And so I have to readjust
It's
that,
okay.
you know?
Yeah, and you're human. I think that awareness is really good because I feel as though this day and age with social media and people talking about things, there is a lot of pressure. And I feel as though it's unrealistic. Like, have you ever looked up a mom influencer? I don't know why they have like, 10 to 12 children all dressed in white. Their houses are perfect.
I
They're
know.
perfect. And I'm like,
Perfect
how
lunch
are
that they
you
make
an
ev
influencer? Like, what is going on?
Yes.
Who can who can live up to that? And do I really want to live up to that? And yeah, like, but there are people that feel bad about themselves in general. And then as soon as you turn on social media, it's in your face and really making you feel bad.
Yeah.
And that's why I've created spaces. My Facebook groups, I've got two of them, one for ADHD and one just for basic parenting, because I wanted parents to come somewhere that they would get quality information and
Yeah.
have a community that is going to give you good answers that are going to support you. Because I've been on some of these Facebook groups, and one, I don't know why you're posting a picture of your child's rash on a Facebook group and asking people what they think it is. And two, it's the same thing for parenting. And it's like, what about this? What about that? And some of the advice is just not good, right? Because maybe that worked for that parent, but that's very old school parenting. You know, I had one parent in one of my groups that I had to really like. I try to teach. I'm not shaming anybody,
Yeah.
um, but she talked about lying. Her daughter lied, picked something like stole something from the store,
Mm,
and the parent was the one advice was like, "Oh, well, you do it back to her, see if she how she likes it." And I'm like, yeah, I don't know how the child's going to learn anything. And instead,
yeah.
let's take accountability. So I try to replace, okay, so I'm not, instead of just saying, no, why would you think something like that? Don't ever do that. Instead, what is the message we're giving our child? If we're saying
Yeah.
this isn't okay, and then we're going to do it, instead, what is going on? What was behind that? Your child
Yeah.
is a dopamine chaser. Their friends were doing it. They're only 10 and you're thinking down the road, what is happening? Because this is happening now, then my child's going to jail. Like, we're all automatically like stressing, stressing,
Yeah.
stressing, right? And let's just look at this moment and let's give this parent some validation that this is a really tough thing and you feel blame, you shame, like embarrassment. What did I do wrong? She knows we never steal anything. Why would she think that that is okay? Well, in the moment, she thinks this is fun. This is a high that she got, and she's a dopamine chaser. And this was fun and it was impulsive, and I got away with it. Well, how are we going to deal with this? Instead of jumping in with saying, how dare you? You can't do that. We're going back. That's our instinct. But we've got a child that this is probably an ongoing thing, and we want them to come to us because then they're going to lie, then they're going to sneak. So instead, saying, I get it. It
Yeah.
makes sense that this was kind of fun. However, now after the fact, what are we going to do about it?
Yeah.
And what I suggested is that she went back to the store and she owned it with the manager and brought it back. And you're doing it in a way that's supportive, but parents feel like if I'm being supportive, if I'm validating their emotion, that I'm saying their behavior is okay. And that's not it. I'm not
Yeah.
saying it's okay, but I'm looking at your experience, and like you said earlier, I'm stepping into your shoes, and you're a kid and you make mistakes, and this is how we're accountable. This is how we learn from our mistakes. Because again, to your point, your children are not a package deal. Some children are very resilient, born in the same home. Another child born in the same home, same parents, same upbringing is not resilient, but we can teach. And this is how we teach.
I love the way that you use that example of like how to handle it and kind of just put that a spin on it to where it became a learning moment that I'm sure can turn into something that this child is going to remember forever and help to shape, how they view things and their value system on their own versus just you like kind of browbeating them
Yeah.
about, you should, and then they still don't really understand until maybe much later on, like all the ramifications of, kind of what went wrong with the decision. So I love the way that you worded that and helped. I am
Yeah.
curious, just kind of segueing over a little bit into the conversation about ADHD. How, as a parent, do you recognize if maybe we're going from this is maybe appropriate behavior for a child at this specific age to we might have an additional area of concern that we need to have addressed. Because sometimes we don't know maybe if it's just like, okay, are they just being, appropriate for their age? Or is there something else here? What should parents look for?
Again, a really, really good question. And I think just talks to me about what people out there are looking for, right? And that I don't know the answers. And that's where you're looking at one, education is really important. So if
Yeah.
you feel as though this is something's going on here, and you watch, there's this video that I show to parents for children with ADHD, and literally it is like this little boy going through his day. He gets distracted going up to his room. He grabs his homework. He sees a Lego guy or Lego car that he forgot about. And he's focused on that. What does he do with his homework? Down on the ground. He goes to school. He blurts out answers. A fire truck comes by. He needs to get up to see that, even though he's writing a test. And parents
Yeah.
watch that and they're like, oh, yeah, that's my kid. Right? Like, so it's sometimes those things, like when you're watching and you're like, is this because, you know, I feel like everybody on TikTok, you know, I have ADHD, I have this, and you start thinking, geez, maybe I have ADHD. And maybe you do, because most people were not diagnosed.
Yeah.
People are getting diagnosed now, but it's really watching those things, doing the checklists like Attitude Mag and understood.org. They have great little checklists. And,
Mhm.
it's coming from evidence-based strategies. And you're looking at these things saying, this matches. And you just know when it
Yeah.
matches. And then it's like, okay, so now what? Now what do we do? And what are the next steps? Because that's tricky for parents as well. You can get started on parenting strategies because a child with ADHD or a strong willed child or a child that's neurotypical, all the strategies are going to be exactly the same, right?
Hmm.
Where we have the structure, where we're consistent, we set boundaries, we have timers and checklists. That's going to help anybody.
Yeah, for
But a
sure.
child with ADHD, they're going to need more of that because they're going to have more squirrel moments. They
Yeah.
are very emotional. So ADHD and emotions go hand in hand. It's not in the DSM because it's not measurable, which you would know as a researcher, right? So, but it's there.
Yeah.
So we see that this child is going to have bigger meltdowns, is going to need more time, is going to need more structure. So this is going to take longer than maybe your neurotypical child that maybe is even younger than your ADHD child, is kind of just going to go in the flow and get it. And
Mhm.
then you're like, this child, we're still working on it. We're still working on it. But knowing that, looking at small degrees of change. So go with your gut, educate yourself, and be the squeaky wheel. Because sometimes your doctor, like I said earlier, is like, meh, it's fine. They'll grow out of it. And also, what is that clear expectation of what is going to be the treatment? Because I see this a lot working in pediatric medical health, mental health. People are wanting a 4-year-old to get therapy for their anxiety. Cognitively, they cannot do that. ADHD, actually, there's no treatment for ADHD. It's emotional regulation, social skills, and parent training. That's what the research is saying for all children because you can't make your child change.
Yeah.
You can change your reaction, right? Going back to that motivating. How do we motivate them? Well, actually, children with ADHD, you acknowledge their effort, you have a reward chart for them. That motivates them because they get in trouble all the time. So when you notice them doing good things and label, you listened right away. He may be screaming, but he listened right away. Focus on what he is doing, right? So I did not give you a clear answer again. I apologize.
You gave a lot of good information, which is always helpful. I'm curious to know, there's a ton of research out there that shows kind of some of the negative ramifications, specifically for African American boys, when it comes to over labeling, over diagnosing in an educational setting for whatever reason, that it tends to happen. And so, kind of as blowback from that, parents don't necessarily trust experts when they hear, go, your child has a behavior issue or they have ADHD, you need to go and get them properly diagnosed. So it's kind of working against the professionals because they may be given an opinion and now the parent doesn't necessarily trust what that individual is saying. And then you have a parent who is possibly not getting resources for a child who may need them. Have you ran into any complexities with navigating kind of I guess I would say more of like a cultural perception of ADHD? And if so, do you specifically consider culture when you are talking about treatment and getting involved with parents, especially with what you're offering?
Yeah, I that's a really valid point. The mental health stigma is something that we are working on. And yes, ADHD is has a huge stigma. So in my private practice, when people come to me, they're looking for support. Sometimes, a lot of times, there's no diagnosis yet, right? So if there is some cultural barriers or that stigma is there, then I try to step away from let's just focus on the child and let's just focus on what they need. Because diagnosis or not, this child is struggling. And sometimes, unfortunately, what happens is that the only way you can get support is when you have a diagnosis in the school board. So you can have a child that's behavioral, and then parents are just looking for a diagnosis, or teachers are saying, you need to get this kid diagnosed. I actually heard of somebody saying that in order to keep the child in school, you need, in the private school, you need to get a diagnosis and you need to get them on medication, or we're kicking them out of school. Like that's a lot. That's a lot of pressure. And what are we looking for? So there are barriers, as you said, where children are being labeled, and maybe there's a misdiagnosis. What I see a lot of is that there's no diagnosis and then late diagnosis of autism, for example. And now we're trying to catch up. So I feel like this is again one of those questions that we have to look at: where is the blame going? What are the results of overdiagnosing and overmedicating children? And are we just putting band-aids on everything? And then where does the culture piece come in? Because does this seem like a shame and blame thing? Does this feel as though that if you don't do this, you're not a good enough parent?
Yeah.
And this is just what we deal with. So just go and get that diagnosis and suck it up. And that's not okay. But a lot of parents feel stuck, and they're not clinicians, they're not psychologists, they don't have child, development background. And then you've got a teacher telling you, or a school system saying, this kid is not okay. So you need to fix it. And there's a disconnect. There's a disconnect between what are the services, what's happening at school, what's happening at home, and less of this blaming game and diagnosis. And what does the child need here? And how do I teach them at home? And then how do we transfer these skills? I don't know if I answered your question.
You did.
Okay.
It's funny when you tell me that. You did. But this is one of the things that I really, a lot of time social media and the internet world, so to speak, kind of gets a bad rap. But this is one of the things that I do love about social media and YouTube and Google University. I like it for this specific aspect. There's
Yeah.
information out there that you're able to get to help you handle different situations without necessarily always having a diagnosis. A diagnosis is necessary, in my opinion, obviously,
Mhm.
for some things, but I do feel like that there is an overdiagnosed um, culture for sure. I've heard this statement verbatim: we don't do anything without a diagnosis.
Yes.
As you said, why would we need a diagnosis for every single thing when we are all human beings who we can't categorize for
Mhm.
every action that we have? We have research that shows that, your adult attention span, they say, increases based on your education level. But
Mhm.
even some research was saying, even as short as like 10 to 15 years ago, that with an undergraduate degree, your attention span is typically only 15 to 20 minutes.
Wow.
So, by nature, if we're talking about like, okay, do we throw this individual into a box of maybe there's some issue here, or are we just dealing with human beings? And so, for that reason, not to throw diagnosis to the wayside, but that's why sometimes I feel like we overdiagnose to an extent. And I'm glad that people have access to different avenues of information to figure out, okay, this is the issue I'm seeing. What can I do to help support my child better,
Yeah.
for this specific thing? Please don't let this be your segue to no longer visit the doctor or whoever. No, this is
Yeah. Yeah.
just my 2 cents on my,
I agree with you.
social media.
Yeah. And you know what's interesting is to your point of like this diagnosis, but what you were talking about is more overdiagnosis and almost like it's been forced on the
Yeah,
families. And now, oh, look, all African American boys all have ADHD. Like, what's going on there, right? And
yeah,
what does that do, um, as far as moving forward in the trajectory of boys that are already stigmatized and
yeah.
just labeled, and that's not okay. So that's very. I'm glad that you brought that up because I need to know more about these things. Maybe that's another podcast episode where we can dive into those things a little bit more.
Yeah,
But what I see a lot in Facebook groups, especially, even in the one that I run for ADHD parents, is we've got people that want diagnoses and medication for their children at 4 and 5. And ADHD should not be diagnosed until a child's at least in grade 1. So we can really see how is their focus, what is
yeah,
going on. And we do have some parents that I don't know what it is. And like, will this diagnosis change something? And I feel like it might be just like us, like, oh, is something's going on? So the doctor has told you, yes, you have IBS. I'm like, okay, now I can work with this. But do you need that validation when they're 4 and 5? And I see parents are getting frustrated. How do I get these answers? And it's almost like with a diagnosis that parents feel like there's a package that's going to come to the door to fix everything, right? That once I
yeah.
get that diagnosis, then all the service will happen and then someone can fix this kid,
I
right?
think it's too, and we have this chat a little bit offline about perceptions and people pleasing and kind of how you present. And I
Yeah.
think this is part of it, not speaking for all parents.
Yeah.
But when you get that label, you get the diagnosis, now it no longer becomes to the people who are seeing you as a parent that you aren't capable of parenting, or because typically it's she can't get a handle on her kid or whatever it is. There's a
Yeah.
situation, but it's like, wait a minute, here's my get out of jail free card, ADHD. Now the
Right.
attention no longer goes from you and your parenting ability. It's no, it's not me as a parent. I have a child who has this particular issue. And so, see, I am a good parent. My child has ADHD, and this is the situation. So now there's no longer the fixation on your ability to parent. So I think in that way, it validates some people because, you have what you present, how you present as a parent to the outside. And then also, we can't discount that internal voice that can run like the wind and that can rip somebody down quicker than the outside. And, you start to question yourself like, oh, am I a bad parent? Why can I not?
Yes.
And then again,
Yes.
you have that get out of jail free card. ADHD, I'm a good
Right.
person,
Right.
it's
Right.
it's the kid, so I think that's part of
Right.
it.
Judge you there. So thank you. This makes a lot. I just need that validation that I'm not a bad parent. And see,
Yeah,
I told you this
yeah.
kid is, yeah. There we go. See, we're learning. Lots of learning happening
There
this
we go, for sure. I'm curious to know, your book, I Quit, Oh, Wait, I'm the Mom. First of all, I love the title.
Thank
I
you.
feel like we've all said that at some
Yeah.
point. Tell me a little bit, it's one of how many books do you have?
So I have one book, and I know this is something that people keep asking me about. I do have it here, my little, just a short little book. I wanted it to be for moms, like just like there's not even a lot of writing in here, right? Just like really simple stuff.
Yeah.
Just like I wanted a parent to be able to open it and be like, oh, I just need a message for today, right? Like, give yourself a break. We all make mistakes, but our mistakes don't define us. Failure is okay. It's what you do with it that matters. Getting back up is what you should focus on. And maybe somebody just needed to hear that. And so this kind of started my career. I always wanted to write a book, and I was working in like teaching parents, doing workshops that, in healthcare and
Yeah.
mental health. And I'm like, how do I give messages to parents that life can be different? Small degrees of change. Our response versus our reaction really makes a big difference. And this
Yeah.
whole mentality of like, it's wine o'clock for moms, that we all just deal with like complaining and drinking all the time. And I'm like, yeah, like having a glass of wine is okay. But if you're numbing your pain through a box of wine a day, okay,
Yeah.
where this is normalizing alcoholism. Like what is going on here, right? Like let's step back a little bit. And we are in survival mode a lot, like where we're
Yeah.
just pushing through, and it doesn't need to be that way. And what my motto was, my floors may be sticky, but I always make time for myself because the floors will be there. I will come back to it, but I have no strength. I can't move forward. And then my child is freaking out over the purple cup and my head pops off. And when you step back from that and say, wait a minute, something can be different. That's
Yeah.
why I created this. You could read this book in 2 hours if you had 2 hours. But I
Right.
also wanted someone to pick it up and read one chapter or go back to it. And it really it was a great segue into my career and my my business. And I am now I got on to a local news station. I'm now their parenting coach, right?
Oh,
I go on
fun.
monthly. Yeah, so on monthly, I'm their parenting expert, right? So I go on, and once a month, and we talk about parenting stuff for 3 to 5 minutes. So it has to be really quick. But it's always fun, right? And it's just been rewarding for me to give little bits of information and little nuggets to parents. So my book was one step, and then my career followed. Yeah.
I love that you can read it in 2 hours, and I love to read for one, so I read it anyway. But I feel like we're all so busy and we're always rushing, so I love that about the book and that you're gonna get some encouragement and some advice. So I'm definitely picking up your book, and I will be reading it over the holidays, so I'm excited about that. Michelle, it's been so great to have you here. Can you let us know how can we follow you and individuals who wanna hear more about what you have to say about parenting, how can they connect with you?
Yeah. So I am Mom the Manager, and it's momthemanager.ca. I'm a Canadian. I'm in Ontario. So it's momthemanager.ca. You can book a free 15-minute call with me if you have questions. I am Mom the Manager on Instagram, on Facebook. I have two Facebook groups called Overworked to Overjoyed, and then my other one is ADHD Parenting. So lots of free stuff in there, lots of free videos. I go live for 10 minutes, usually once a week. So lots of content there if you're just looking for little bits of information. And I see people one on one, and I have on demand programs as well. So more of that is coming up because I think some parents just need information right now, not
For sure.
necessarily waiting to book a call and things like that. Yeah.
I love it. As always, I will link everything in the notes. So if you don't have a pen, no worries. Just click down in the comments and you will be able to connect with Michelle and get all of her wonderful information. So, Michelle, we end every episode with the same question, and I'll ask you, what is the best advice you've ever received or one piece of encouragement you would pass on to someone you deeply care about?
Advice. I remember one time somebody told me on my wedding day over 20 years ago, just step back and take it all in. Just enjoy what is going on around you. And I did that day. And I do that in life as well, where I try to step back. I watch my children. I have an 18-year-old and a 15-year-old. So I've watched them, though, through their eyes, what they're enjoying and not getting caught up in the chaos of life. So that has helped me over 20 years. I've tried to incorporate it. And then as far as supporting other people and encouraging, you are doing the best that you can with what you have, and that you deserve to be happy. And asking for help is not a weakness. Asking for help says, I deserve this, my children deserve this, and things can change. But it's really scary to ask for help because there can be judgment attached to it. So give yourself some grace.
Great advice. Great advice. Michelle, thank you so much again for being here. It's been so awesome chatting with you. I learned a lot. I took a lot of notes today. So I appreciate you
Good.
taking the time to join us. Hannah's Hive,
Mhm.
you've been listening to the Hey Hannah podcast. If you haven't already, please give us a quick review and rating on iTunes. We'd absolutely appreciate it. And don't forget that you can follow us on Facebook and Instagram. We'd love to connect with you in social media land. And we will be here next week, same place, same time. And until next time, everybody, take care.
And that's it. I'm out of here.
Thank you so much for joining us on this episode of the Hey Hannah podcast. We hope that you found inspiration, insight, and encouragement in our conversation today. If you enjoyed this episode and want to stay connected with us, be sure to like, subscribe, and review the Hey Hannah podcast. Your feedback helps us reach more people and spread our message of love and wisdom. You can also follow us on social media at Hey Hannah Podcast. Find us on Facebook, Instagram, and TikTok to stay updated on all the latest episodes, behind-the-scenes exclusives, and engaging content. And for those of you who prefer the visual experience, catch the video versions of our podcast on our YouTube channel. Just search Hey Hannah Podcast and hit that subscribe button to never miss an episode. For even more Hey Hannah goodness, visit our website at www.heyhannahpodcast.com. There you'll find updates, bonus content, and join a community that embraces you with open arms. Your continued support truly means the world to us. Together, let's spread love, share wisdom, and honor every precious moment. Because here at Hey Hannah, we believe that life is meant to be lived well. Remember, a new episode of the Hey Hannah podcast is released every Wednesday, so mark your calendars and be sure to tune in. Thank you again for being a part of Hannah's Hive. Until next time, take care.
Entertainment. Entertainment.